Thank you all for joining us today. As Richard introduced, I am Lyric Jorgensen. I'm currently the Acting Associate Director for Science Policy at NIH and have been working really hard on data management and sharing efforts for NIH for some period of time now. And so I'd like to thank you all again for coming here today. I wish we could be here in person and down at the academies having all of our productive conversations, but I'm grateful for the many who have registered for this meeting. I think it really shows the interest in this topic and the commitment to make our efforts successful here. I also want to echo Mary Ann's comments on thanking the academies and the planning committee. You guys did a really Herculean level of work on this workshop, and I think it's really showing in the agenda over the next few days. So thank you again for all of the time you invested in making this workshop maximally successful. As mentioned, NIH has been committed to data sharing and data management practices for some period of time now. It has been part of our fabric for a while, recognizing all of the values for which it holds for us as a scientific enterprise. This has culminated in the release of a new policy for data management and sharing, released last year. I think it was last year now. Time is starting to run in the COVID pandemic world. And hopefully you've all had a chance to read it and are familiar with the details so that we can dive into an effective conversation. For those who have not had a chance to read it, or for possibly those on the West Coast who haven't had their coffee yet, just give you a quick reminder of what we aim to achieve here, which I think was also in the intro remarks. Basically, our goal here is to aim to foster data stewardship. You'll notice that our policy is kind of long because it includes management and sharing. We're really committed to the data management enterprise and then how data that are needed for advancing science are shared in a responsible manner. Our policy, the nuts and bolts, requires data management and sharing plans for all NIH-funded research. This is a plan developed by our investigators telling us how they're going to share their data, where they're going to share their data, and when they plan to share on the data. There's some flexibility built into the policy so that the researchers who are most familiar with what they're doing can tell us how they plan on doing it. So we're looking forward to the implementation of this policy in 2023. Notably, we built the additional flexibility to allow for modifications over time. This is an important component, knowing that science changes and your research aims might change over time. So we've built in the ability to update plans over a period of time to make sure that it really matches what you intend to do. And importantly, we do that because we intend to have compliance a factor into future funding decisions. So this is an important policy, and we want to make sure we get compliance and implementation right to make it as seamless a transition as possible for the community. Along those lines, we've developed supplemental information to help the community develop plans. This includes what are the elements of a good plan? How do you build in factors such as cost? We at NIH recognize data stewardship requires investment, whether it be in repositories, in staff time, and we plan to invest in that. And so that's part of our policy, is to allow for those costs. Notably, as we mentioned, this is not going into effect in 2023. And again, because we want to work with the community to get this right. We want to incentivize culture change across the research enterprise. And we're here today to talk about how to get there. I don't know that I need to go over, I think Richard did a nice job talking about why we want to share data and why NIH is so committed to this. I mean, the breadth and diversity of the data that NIH-funded researchers generate is immense. We have everything from numbers and letters to complex images, and then all the unique combinations of that data in between. So it's really a treasure trove of information for advances. And again, Richard, I think, did a nice job already outlining why we want to share data. It advances science, it makes our science better, it makes previously unavailable data sets available to new minds who can create new kind of research inquiries and new discoveries. And so it's a really important asset, part of the research project and not an add-on. Importantly, collectively, all together, this maximizes our ability to collect data. It reduces redundant studies that are not needed necessarily. It maximizes participant contributions. Importantly, our data sharing policy is data agnostic. This is not just about human participant research data, but all NIH-funded research resulting in scientific data. But we do have a unique commitment to research participants who believe that they are contributing their time and their specimens to biomedical research to make research advances. And so making sure we maximize those contributions to advanced science is really a commitment that we tend to uphold. The other component of sharing data is fosters stewardship. It tells us how our research is being used, provides transparency and accountability for taxpayer funds, and enables trust in the entirety of the research enterprise. And so this is a really important component for NIH as stewards of the taxpayer's dollar in biomedical research. And of course, why a lot of the reason we're here today is it accelerates the research enterprise. And these are all the reasons above, the reasons Richard described and more. And so we really want to make this a collective ecosystem. So I want to talk about why we're having this workshop today. And again, we are delighted to have the group and such a large group of participants in today's workshop to talk about these issues. As mentioned, we want to incentivize the way for responsible data sharing. We want to make this part of a research norm. I believe Dr. Collins said he wants to make data sharing no longer unique, but the norm of the research process. And that's what we want to do. We want to work with the community to make sure that we can make this a real culture shift and not a blip on the screen. So we're convening all of you today, the researchers, people who manage data sets and the data stewards, research participants, people who might be users of the research data, and more to inform how we implement the policy at NIH. Again, some people noted that the effective date for the policy is until 2023, and that's to make sure we've gotten all these pieces completely right to be able to have a seamless implementation. So over the next few days, what we are really hoping from you all is a really robust conversation about examples of responsible data sharing practices and infrastructure. For many people, many research communities, this isn't new. This has been a practice for some period of time. Let's learn from it. Let's learn from what has worked well, what hasn't worked well, and how can we pave the path forward for others who are going to be developing their own systems. We also want to work through any implementation challenges that we see on the horizon. We recognize things like cost and estimating costs and things like that may all be challenges for researchers. And how do we help people get through those? What are the resources available, and what are the other additional resource needs we need to think about collectively as the enterprise to make sure everyone feels that they've got what they need to advance responsibly. And of course, at the end of the day, we want to understand, what does successful data sharing look like, and how will we know that we got there? I think my predecessor, Dr. Wallenitz, would always say, how do we know the juice is worth the squeeze? What are the metrics that we are looking at? There are metrics such as data reuse. That might be a rarity. Having reproduction of studies, that might be more common. And how are we using the data, and how are we making sure that it's available? So these are some of the things I hope to discuss with you all over the next few days, and then share these resources with the community to really prepare ourselves for implementation in 2023. So with that, I just want to say thank you all again for being here today. I know on behalf of all NIH, we're really excited to have such a huge number of our community involved in this conversation, because it's really a partnership across all stakeholders to make this really part of the research process. So thank you very much. And I will turn it over to Dr. Brennan, I believe.